Hi, so we're going to be taking multiple questions on multiple choice questions on lung tumors. Before we start, I want you to like my video, subscribe to my channel, and share with your friends. Thank you so much. So let's dive right in. The first question here says, what is the second most common cancer in the UK? A. Breast cancer. B. Lung cancer. C. Colorectal cancer. D. Prostate cancer. 2. What percentage of lung cancer are caused by cigarette smoking? A. 50%. B. 70%. C. 90%. E. 100%. The first answer is lung cancer, and the second is 100%. So the percentage of lung cancer caused by cigarette smoking is 100%. Which of the following is not a known risk factor for lung cancer? A. Asbestos exposure. B. Passive smoking. D. High fiber diet. D. Radon gas exposure. What's the answer? 4. What percentage of lung cancer are small cell lung cancer? A. 10%. B. 20%. C. 35%. D. 50%. Number 3 answer is high fiber diet, and 4 is 20%. Number 5. What type of lung cancer arises from Cushing's cells? A. Adenocarcinoma. B. Squamous cell carcinoma. C. Large cell carcinoma. D. Small cell lung cancer. Number 6. Which of the following is not a symptom of lung cancer? A. Cough. B. Hemoptysis. D. Night sweat. C. Night sweat. D. Weight loss. Number 5 is D. Small cell lung cancer, and C is night sweat. So the type of lung cancer that rises from Cushing's cells is small cell lung cancer, and night sweat is not a symptom of lung cancer but a symptom of tuberculosis. Number 7, which nerve is affected by recurrent laryngeal nerve palsy due to lung cancer? A. Phrenic nerve. B. Vagus nerve. C. Recurrent laryngeal nerve. D. Sciatic nerve. 8. Which imaging modality is best for staging lung cancer? A. Chest X-ray. B. PET or CT. C. MRI. D. Abdominal ultrasound. 7 is recurrent laryngeal nerve. 8 is PET or CT. Okay. So the nerve affected in recurrent laryngeal nerve palsy due to lung cancer is recurrent laryngeal nerve. And the imaging modality for staging lung cancer is your PET or CT scan. Number 9, what is the first line chemotherapy for malignant melanoma? A. Cisplatin plus pemetrexed. B. Doxorubicin plus cyclophosphamide. C. Methotrexate plus 5-fluorouracil. D. Vincristine plus etoposide. 10. Which lung cancer is most associated with asbestos exposure? A. Small squamous cell carcinoma. B. Adenocarcinoma. C. Large cell carcinoma. D. Malignant mesothelioma. The answer to 9 is cisplatin plus pemetrase, and 10 is malignant mesothelioma. The first line chemotherapy for malignant mesothelioma is cisplatin plus pemetrase, and the lung tumor most associated with asbestosis is malignant mesothelioma. 11. You're going to be filling in the blanks. If you follow the lecture, you fill in this blank. Lung cancer accounts for -% of all new cancers in the UK. Number 12. Only -% of lung cancer cases are cured. 13. The most significant risk factor for lung cancer is dash. 14. Small cell lung cancer account for -% of lung cancer cases. Let's go. So number 11 is 13%. 13% of all new cancer cases is lung cancer. And only 5% of lung cancer are cured. And cigarette smoking is the most significant risk factor for lung cancer. And 20% of lung cancer cases are small cell lung cancer. 15. Lung adenocarcinoma account for -% of non-small cell lung cancer. 16. A common early symptom of lung cancer is dash, present in 80% of cases. 17. Lung cancer can present with finger dash, a classic sign of chronic hypoxia. 18. Hypertrophic pulmonary osteoarthropathy is associated with dash. 15. 27% of non-small cell lung cancer is the lung adenocarcinoma. And cough is said to be an early symptom of lung cancer that presents in 80% of cases. Finger clubbing is a classic sign of chronic hypoxia that presents in lung cancer. And hypertrophic pulmonary osteoarthropathy is associated with lung cancer. Number 19, recurring laryngeal nerve palsy may present with dash. 20, superior sulcus tumor or dash tumor can cause Horner syndrome. 21, brain and bone metastases are common in lung cancer, often leading to elevated dash level. 22, sputum cytology can help diagnose lung cancer by detecting dash cells. 19, hoarseness. Recurring laryngeal nerve palsy may present with hoarseness. 20, a superior sulcus tumor or Pancoast tumor can cause Horner syndrome. Brain and bone metastases are common in lung cancer, often leading to elevated calcium levels. And sputum cytology can help diagnose lung cancer by detecting malignant cells. 23. A chest X-ray in lung cancer may show a dash nodule. 24. Fine needle aspiration is used for biopsying dash lung lesion. 25. Bronchoscopy help assess tumor dash in operability. 26. The most common benign lung tumor is a dash. 23 says peripheral. A chest X-ray in lung cancer may show a peripheral nodule. Fine needle aspiration is used for biopsying in peripheral lung lesion. 26. histology. Bronchoscopy help assess tumor and tumor histology and operability. Then the most common benign lung tumor is hematoma. 27. Mesothelioma is caused by exposure to dash. 28. Latency of mesothelioma development can be up to dash years. 29. Pleurodesis is a palliative procedure for recurrent dash in mesothelioma. 30. Prognosis for mesothelioma is poor, with survival often less than dash years. Asbestos. Mesothelioma is caused by exposure to asbestos. That's 27. 28 is 45. Latency of mesothelioma development can be up to 45 years. 29 is pleural effusion. Pleurodesis is a palliative procedure for recurrent pleural effusion in mesothelioma. And 2 years, number 30 is 2 years. Prognosis for mesothelioma is poor, but survival is often less than 2 years. 31, now we're going to clinical questions. A 65-year-old smoker presents with hemoptysis, weight loss, and persistent cough. A chest X-ray shows a hilar mass. What is the most likely diagnosis? 32. You can pause the video and answer the question before we go to the main answer. 32. A 50-year-old woman presents with ptosis, meiosis, and anhidrosis in the left side of her face. A chest X-ray reveals a mass in the apex of the lung. What syndrome is this? 33. A 45-year-old man with lung cancer presents with hoarseness. What is the likely cause? So 31 says lung cancer. A 65-year-old smoker presenting with hemoptysis, weight loss, and persistent cough. Meanwhile, cough is the most significant or the most earliest symptom, and the chest X-ray has shown a hilar mass. The diagnosis now we're going for lung cancer, which could be a squamous cell carcinoma. 32 is Horner syndrome, likely due to Pancoast tumor. A 50-year-old woman presenting with ptosis, meiosis, and anhidrosis. On the left side of her face, a chest X-ray has revealed a mass in the apex of the lung, and the syndrome is Pancoast tumor, most likely Horner's syndrome. Then the 33 is recurrent laryngeal nerve palsy. A 45-year-old man with lung cancer presents with hoarseness. What is the likely cause? Recurrent laryngeal nerve palsy. 34. A patient with known small cell lung cancer develops confusion, seizure, and hyponatremia. What paraneoplastic syndrome should be suspected? 35. A patient presents with persistent dyspnea and a pleural effusion. Cytology of the pleural fluid reveals malignant mesothelioma. What is the likely diagnosis? 36. A 68-year-old man with lung cancer develops facial swelling and distended neck vein. What complication is suspected? So before we go to the answer, can you pause and answer? Alright, so 34 is SIADH, syndrome of inappropriate antidiuretic hormone. A patient with known small cell lung cancer develops confusion, seizure, and hyponatremia. What paraneoplastic syndrome should be suspected? That's the SIADH, syndrome of inappropriate antidiuretic hormone. And 35 is malignant mesothelioma. A patient presents with persistent dyspnea and pleural effusion. Cytology of the pleural fluid reveals malignant mesothelial cells, and the likely diagnosis is malignant mesothelioma. Superior vena cava obstruction. A 68-year-old man with lung cancer developed facial swelling and distended neck vein. What complication is expected? And that is superior vena cava syndrome or obstruction. 37. A patient with lung cancer presents with bone pain and hypercalcemia. What is the likely cause? 38. A 60-year-old man presents with muscle weakness that improves with exercise. He has small cell lung cancer. What paraneoplastic syndrome is suspected? 39. A 58-year-old male presents with sudden onset dyspnea and pleuritic chest pain. Chest X-ray shows a collapsed lung. What is the likely diagnosis? 40. A patient with lung cancer has a PET or CT scan showing adrenal and brain metastases. What is the TNM stage classification? 37 is bone metastasis. A patient with lung cancer presenting with bone pain and hypercalcemia. What the likely cause is bone metastasis. 38 is Lambert-Eaton myasthenic syndrome. A 60-year-old man presenting with muscle weakness that improves with exercise and has a small cell lung cancer. The paraneoplastic syndrome suspected for him is Lambert-Eaton myasthenic syndrome. And 39 is lung cancer due to tumor obstruction. A 58-year-old man presented with sudden onset dyspnea and pleuritic chest pain, and the chest X-ray showed she has collapsed lung. The likely diagnosis is lung collapse due to tumor obstruction. And 40 is stage 4. A patient with lung cancer that has a PET or CT scan showing adrenal and brain metastases as a TNM staging of stage 4. Thank you for coming up to this end of the for following me up to the end of the video. Please like my video, subscribe to my channel, and share with your friends. Wait for more. Let me quickly go through. Okay, we've gone through the previous lecture. Always check the link, the explanation in the lecture. Thank you very much. Appreciate.